Thank you, Mr. Chairman. Dr. Famaka, HRSA's report notes that in most cases, once authorization had been obtained and the coordinator's attention turned to operative logistics, there was scant subsequent recording of patient's clinic condition. What are OPTN's policies as it relates to data and record keeping?
The OPTN stipulates that OPOs have to collect and retain data points. I would be not accurate if I tried to tell you what all those data points are. I think that the challenge from where I sit as a clinician is having OPO staffers in a hospital of varying degrees of medical training. They're not physicians, some are nurses and most are not, doing physical exams, neurological exams, making assessments of patients. That makes me feel uneasy.
Do you believe there should be more thorough records when assessing a patient's neurologic condition prior to recovery efforts?
Answering from the perspective of physician in the hospital, absolutely. That needs to be documented by the physicians that are caring for the patient because they're making life and death decisions. To the degree to which an OPO would be documenting that finding, taking it from the medical record, I think they should be doing that as well. I don't feel comfortable having an OPO making an assessment of that, though. I think that must stay in the hands of the patient's physicians.
Okay, thank you. Mr. Massa, do you believe that Network for Hope has a culture that encourages the reporting of complaints or concerns historically and currently?
Yes, sir. Matter of fact, our policy states that not only do we encourage that, but you are obligated to do so. And if a complaint is, they do not feel comfortable raising a complaint to a corporate compliance officer or their supervisor or a member of the executive team, they could do so anonymously through a QR code, and they remain, it's completely confidential of who that person is. And so again, we encourage people to do this.
The OPOs are required to provide organ donation data to transplant hospitals they have agreements with. What is included in this data, Mr. Mussa?
With the transplant, everything related to the donor, including any lab test, their blood type, serologies, HLA testing, all the background related to the person's uniform risk assessment as far as their background. So there's quite an extensive list of information provided to the transplant center before they accept a organ.
What about complaints or incidents related to a potential donor? Would they be included in this data?
We actually provide a way for hospitals to make a complaint, and again, we offer that ability to do it confidentially as well.
Okay, all right, great. Well, thank you, and Mr. Chairman, I yield back.